Small steps can make a big difference in your health. More than 10% of this country's population, that's about 34 million people, live with diabetes. Joining us in what is Diabetes Awareness Month, Dr. Griffin Rodgers from the National Institute of Diabetes and Digestive and Kidney Diseases. Doctor, thank you for being with us today.
Okay, thanks again for having me on your show.
Absolutely. Why do so many people suffer from diabetes in this country, doctor?
Well, you know, a major risk factor for diabetes, specifically type 2 diabetes, is the obesity. Obesity is really a major driver. And in the state of South Carolina, the obesity prevalence is in excess of 36%. It's estimated by the CDC to be 11 in terms of states in this country. And so that's what's really driving it. The diabetes number you referenced, 34.8 million, but that's just the tip of the iceberg. There are about 88 million people who have prediabetes, a precursor of diabetes, and I would say 80% of them, those individuals, are totally unaware that they have it. But in the next 5 to 10 years, over 50% of them will go on to develop type 2 diabetes.
88 million people with pre-diabetes. What does pre-diabetes even look like?
So pre-diabetes is a serious health condition where your blood sugar levels are higher than normal, but they're not yet high enough to be diagnosed with type 2 diabetes. It's in transition. But as I said, the CDC estimates that 1 in 3 U.S. adults has pre-diabetes. The risk factors for prediabetes are the same as they are for diabetes, obesity, or being overweight. If you're over 45 years of age, you're at increased risk. If you have a family member, such as your parents or a sibling, who's been diagnosed with diabetes, you're at increased risk of having prediabetes yourself. And certainly certain racial and ethnic groups like African Americans, Hispanics, and Native Americans, or Asian and Pacific Islanders are also at increased risk of having prediabetes.
Let me ask you this. For someone who comes from a lineage of having diabetes, if you live a healthy lifestyle, are you still predisposed to having diabetes? Or as long as you follow kind of all those health rules, exercise, eating well, can you stave it off?
That's the good news. That, you know, obviously you can't change your age, you can't change your family history, and you can't change other genetic factors, but you certainly can change your lifestyle. And so this study that was supported by the National Institutes of Health, the diabetes prevention program, in which they enrolled individuals who were overweight or obese and had a diagnosis of prediabetes, and then this lifestyle modification, which resulted from consuming healthier foods and drinks and being more physically active and losing weight, only about 5 or 7% of their weight. And so, to quote what you just said, small steps, a big difference. You can substantially lower your risk of developing diabetes, so it's not set in stone. And in fact, in some of the people with prediabetes, they actually reverse their numbers, so their blood sugar levels actually normalize just with those interventions. That's why doing it at the pre-diabetic state is so important, by these lifestyle changes, diet and exercise, and trying to lose weight and keeping it off.
Yeah. Sometimes fear is enough to get people to get into action and to get healthy, but without being too morbid. Once diabetes does get too far, what are some of the things that people can start to experience? You mentioned kidneys, eyes, but we hear amputations, dialysis, all kinds of things.
Yeah. I couldn't have said it any better. It's the leading cause of blindness in this country, leading cause of non-traumatic amputation, leading cause of chronic kidney disease, ultimately leading to end-stage kidney disease requiring dialysis or a transplantation. Those are the things that people know a lot about, but heart disease, major cause of heart disease. Yeah. Diabetes itself is considered the 7th leading cause of death. But because of all these other associated end-stage disease, it probably contributes to a much greater extent. And if you have prediabetes, again, the good news is that one could potentially delay or prevent the onset of diabetes, and in certain instances, even reverse it.
Yes. And of course, we're talking about type 2 diabetes. So we've run out of time. Eventually, I'd love to bring you back to the program. We could talk about type 1 diabetes and what's being done for patients who fall under that category. But doctor, I want to thank you very much for joining us today.
Thanks for having me. And if your listeners would like to get more information about prediabetes, they can visit our website at niddk.nih.gov, or they can follow us on social media, Facebook, Twitter, Instagram, at niddk.gov. And again, thanks for having me and sharing this information with your listeners.
Dr. Griffin Rodgers, thank you so much. We're back after this.